Thank you so much for the question, Stephanie. So first and foremost, my name is Kirollos Hanna. I'm the oncology pharmacy manager at mHealth Fairview in Maple Grove, Minnesota. I'm also the assistant professor of pharmacy at the Mayo Clinic College of Medicine. This project that we worked on with the Association of Community Cancer Centers, or ACCC, focused on the multiple myeloma dispensing models. This was a webinar series that is currently available online at accc-cancer.org. This was in collaboration with the Leukemia and Lymphoma Society, as well as the Hematology Oncology Pharmacy Association. And some of our pharma sponsors were Bristol Myers Squibb. Really, the focus of the presentation or the webinar series, as many of you know, patients with multiple myeloma oftentimes face a lot of disparities, not only from a clinical perspective and the treatment paradigm for these patients, which is complex enough in as itself, but oftentimes maybe enrollment in a clinical trial, financial toxicities, and most recently COVID-19 have really impacted this patient population significantly. So one thing that we were noticing across the country is that there were very significant differences in how people managed patients with multiple myeloma, how clinicians optimized care for these patients. Because also, as many of you know, patients with myeloma are oftentimes coming to your infusion center to receive some type of therapy, such as a proteasome inhibitor. They are also going to be on some type of oral chemotherapy, potentially such as immunomodulatory drugs and a steroid component. So obviously, their treatment regimens are quite complex. The immunomodulatory drugs have to go through REMS programs and all the criteria that's required in managing those specific medications. And then on top of that, also the complexities with dispensing from specialty pharmacies and dealing with the pharmacy benefit side, ensuring that patients aren't experiencing any financial toxicities. So really the goal of the webinar series focused on how different practices